This is a health program proposal prepared for the College of Nursing at the University of Hartford for Class Nursing 651 Epidemiology, Professor Veraki, March 1st, 2022, presented by graduate student Robin Sis. Hello everyone, and thank you for joining our discussion on our Pediatric Asthma Health Promotion Project. Our program committee is excited to make a community commitment to help pediatric asthmatic patients that reside in the city of Holyoke, Massachusetts. Our goal is to improve childhood asthma outcomes. We have determined that your contribution will enormously be impactful as our community strives to reach this goal. This presentation today is an outline of our program's purpose, interventions, and goals. I want to say thank you and welcome to our representatives from the local organizations, Holyoke Health Center, Holyoke Medical Center, Holyoke Health Department, Department of Education, District School Nurses, the Pioneer Valley Asthma Coalition, Massachusetts Asthma Action Partnership, and the Strategic Plan for Asthma in Massachusetts. First, I'd like to go over the goals of this presentation. We will summarize Holyoke, Massachusetts uncontrolled asthma prevalence within the city's pediatric population. We will then discuss who the program is seeking approval from. We will understand the program's community diagnosis and the population it is intended for. We will identify the program's intended resources, interventions, and objectives and goals. We will then explain the health disparities that affect most of the program's population. Lastly, we'll highlight the importance of local organization and sponsorship support for this program. Let's start with an overview of pediatric asthma within our own state. Asthma is the leading pediatric chronic health condition in the United States. Furthermore, Massachusetts has some of the highest rates of childhood asthma in the country. According to America's Health Rankings, recently in 2019, 9.3% of children living in the Commonwealth have a diagnosis of asthma. This is compared to the national percentage of 7.3%. Massachusetts is nationally ranked as the 9th worst state for asthma prevalence. To help address this health issue, there have been several high-risk communities that have been identified to help lessen the burden of asthma among children and their families. Health disparities throughout the Commonwealth account for increased rates of uncontrolled asthma. Pediatric asthma in the city of Holyoke, Massachusetts is home to a large amount of asthma cases. Holyoke has been identified as one of the high-risk communities within our state. According to the Health Department and mass.gov, a lot of the city's pediatric asthma prevalence is due to health disparities. High case counts do exist within this community. In fact, in 2017, 869 students out of 4,358 have a diagnosis of asthma. This is a 19.9% of the student population. That is statistically higher than the statewide percentage of 12.1%. Furthermore, in 2020, Holyoke Health Center was treating 3,170 asthmatic patients, and 950 of those patients have been identified as children. An overwhelming amount of research does indicate when discussing pediatric asthma that health disparities matter. The city of Holyoke is touched by 3 health disparities that can affect asthma outcomes. They are socioeconomic disparities, racial and ethnicity disparities, and geographical health disparities. The Asthma and Allergy Foundation is just one organization that explains how uncontrolled asthma rates are higher among populations that suffer from greater health disparities. According to mass.gov, Black and Hispanic children within Holyoke have higher hospitalizations and emergency room visits than white children do. There is also a large presence of low-income housing and families that also produce barriers to care. At a newspaper article in masslive.com, the Board of Health Directors were calling for better asthma control throughout the city, stating that residents that reside in lower income areas face a lot of environmental challenges that trigger high rates of asthma, such as mold, certain insects, tobacco smoke, poor air quality, and poor ventilation due to the nature of urban neighborhoods. Also painted over asbestos, and also just living in old 100-year-old buildings. So we ask ourselves, why does this all matter? First and foremost, it has been reported in several studies that uncontrolled asthma can lead to a reduced quality of life for children. It also can lead to increased amounts of school absences and drive up healthcare costs. For an example, on average, 13.8 million missed days of school in the United States is due to asthma. In 2015, the United States medical costs to treat asthma with medications and hospitalizations and emergency visits reached $50.1 billion. In Holyoke, between the years of 2008 and 2012, children accounted for 1,454 asthma-related hospitalizations that cost the state $2.1 million, and most of those children were covered by public insurances, for an example, like Medicaid. And according to one physician from the Holyoke Health Center in 2021, Holyoke is witnessing problems with school absences related to asthma. And most importantly, research shows that children with asthma experience more inactivity, sleep disruptions linked to obesity, anxiety, and depression. Our committee has designed a realistic and highly measurable asthma health promotion program. To help design our program initiative, we have applied this program to the program planning logic model. The logic model offers a clear 5-step plan that will produce an outline of resources needed for the program, activities or interventions, outputs, outcomes, and lastly, we'll discuss a long-term impact on the community of Holyoke. Our community diagnosis is the high prevalence of pediatric asthma with increased uncontrolled rates of asthma in Holyoke, Massachusetts. The intended population is asthmatic Holyoke Health Center pediatric patients ages 5 to 12. The purpose of this program is to reduce the amount of uncontrolled asthma among the pediatric population in Holyoke, Massachusetts, while closing the gap on healthcare inequalities that directly impact this health condition. The program committee is designed or devised with the Holyoke public health nurse, one pediatric physician from the Holyoke Health Center, one pediatric emergency room physician from Holyoke Medical Center, the Holyoke School District's lead nurse, and 3 parent representatives of asthmatic children who receive care at the Holyoke Health Center. Our program committee will oversee this program. Our program will be 3 2-hour educational sessions to be conducted monthly over 3 months. There will be 5 cohorts that will go through this program. These patients will be patients from the Holyoke Health Center, and they'll be invited to participate in our program. We will begin in April 2022 and end in April 2023. This will be a year-long initiative. The program will be held at the Holyoke YMCA in the meeting hall. We chose the YMCA because of its location and the familiarity that a lot of the families have with the YMCA. And if for those families who do not have transportation, they can there's a bus stop right in front of the YMCA, so they're able to take public transportation to the educational sessions. Next, I would like to discuss the 5 steps in the program planning using the logic model. First, we're going to identify the resources needed for this program. We'll need approval from the YMCA to use their recreational hall. We'll need translators to attend the educational sessions in case some families English is not their first language. We will then need grant funding to pay educators and cover costs of materials. Next, we'll need to construct a team of 5 nurse educators, and then we'll need to create a patient contact list from the Holyoke Health Center to get the names and numbers to invite patients and families to participate in the program. The activities or interventions of this program is going to be the first session will be discussion on how to reduce triggers and symptom recognition. The second session will be the importance of using a peak flow meter, demonstrations on how to use inhalers, and adherence to medications. The third session, patients will get an understanding of an action asthma plan, and it will also end with an outdoor asthma cookout. Interventions should lead to certain outputs. These outputs will be increased knowledge of asthma triggers and symptoms, a greater understanding on how and why to use a peak flow meter and inhalers with spacers, and also families should gain knowledge and become more familiar with asthma action plans and why they're so important. The last 2 steps in the program planning are the program goals. These are outcomes and impact. It is important to have outcomes that are realistic and measurable. We have 5 identified measurable outcomes that we hypothesize will occur. Reports of better asthma management among participating families, an increase in completion of asthma action plans with child's primary care physician at the Holyoke Health Center. We will see a growth in asthma well visits at the Holyoke Health Center and a reduction in school absences seen in the Holyoke School District related to asthma. Lastly, we will see a decrease in emergency room visits and hospitalizations related to pediatric asthma. What we hope to see, our long-term impact on the community, is that the City of Holyoke will see a reduction in uncontrolled pediatric asthma cases and a decrease in pediatric asthma prevalence. We have 5 ways that we're going to measure our outcomes. First, parent volunteers from the program committee are going to design surveys and mail them to the families 3 months after the program ends to see if they have gained better management with their child's asthma. Next, the Holyoke Health Center will monitor the completion of asthma action plans for 1 year. Holyoke Health Center will also keep track of asthma well visits for 1 year. The Holyoke School District will examine how many absences at each elementary school is related to asthma for 1 year. And then finally, the Quality Department at Holyoke Medical Center will report how many asthma-related emergency room visits and hospitalizations are for 1 year. This program will need key approval from 3 major stakeholders. That is going to be the President and Vice President of Holyoke Medical Center, the Medical Director of Holyoke Health Center, and the Department of Elementary Education. This is largely due to the grants that they can offer the program and the fact that they treat the target population that this program is intended for. For our other stakeholders, as you can see, this program, we will need your help to get it running. Each one of you is a target stakeholder. Holyoke Medical Center, we want to reduce the amount of hospitalizations and emergency room visits you have and drive down your healthcare costs. Department of Health in Holyoke, Massachusetts, we want to see improved living conditions among your city. Holyoke Health Center, we want to decrease the amount of pediatric asthmatic children that you're seeing in your office due to uncontrolled asthma. Massachusetts Medicaid and Medicare insurances, we want to drive down your healthcare costs because a lot of the pediatric asthmatic populations within Holyoke have public insurance. And the Department of Elementary Education, we want to keep children in the classroom. And Obviously, the main goal is to help keep our children as healthy as we can. In conclusion, uncontrolled pediatric asthma has negative side effects on children, and research shows that certain pediatric populations are more vulnerable than others. Asthma exacerbations can be controlled with proper management. Holyoke, Massachusetts will benefit from an asthma health promotion program. And also examining health disparities will help improve the prevalence of childhood asthma and improve patient outcomes in Holyoke, Massachusetts. Thank you for attending today's discussion.